Umgeni Med, written and directed by Dr. Melissa Jhinku.
Episode 1.
Welcome to Riverside Hospital, a fictional public hospital based in Durban, South Africa.
In a system that seems to be failing its people, we only have the medical team to keep things together, to heal the injured, and to save lives. Today we joined Lily and her medical school friends as they start their call, working in the emergency room with Dr. Miller.
We have a Mr. Midley. He is a 55-year-old male presented with severe chest pain radiating down the left arm and up the jaw for the past 2 hours. He collapsed at a wedding. He is known hypertensive, diabetic and on insulin. Patient was given aspirin and placed on oxygen. His glucose was 23, blood pressure 162 over 96 and pulse 116.
My husband is dying. I told him to control himself at the wedding. But that man, he just can't eat one samosa at a time. No. Oh, the people were looking when he collapsed at the wedding. Oh, I must face them now.
Please get her out of here. I need to do my job. Get him in the recess room now. Where are those bloody students?
Here.
Seriously? What are you looking at me for? Get Mr. Moodley into the recess room now.
Must I change him over to our oxygen, set up the monitoring and get the ECG?
Don't ask me stupid questions. Do what you learnt. Why do I always end up with these useless students? Crap, he's going into cardiac arrest. Someone start compressions. You, go get me a real doctor and an intubation set. No gloves in this hospital. I can't work under these conditions. Intubated. What are you doing? Don't you know how to do chest compressions? You're not giving him a massage. Don't waste my time. Just move.
I'm sorry, Dr. Miller. I just...
Paramedic, please continue the chest compressions. I can't deal with these students.
Oh my gosh. My husband is dying. I don't know what I did to deserve this.
I see that you had another busy night, Dr. Miller. 31 patients and 19 new admissions. Students, I hope that you learned a lot on your call. Dr. Miller is one of our best junior doctors. Dr. Miller, you've been working 26 hours straight, and I know you need to come back tonight for your next shift. Let's get this handover to Dr. Singh done quickly.
Kiara, who's that? It's Dr. Singh. He's another junior doctor.
Another Dr. Miller?
He's very sweet. I've worked with him before. He's very calm and he likes to teach. He's the opposite of that cranky Dr. Miller. He's very good with the patients. And the nurses love him too. You can see why.
I know the kind. I'm sure he uses his good looks on all the girls. I don't know what is up with these stupid girls falling for any guy that tells them they are a doctor.
No, he seems to be genuine and... Shh! The ward round is starting.
This is Mr. Moodley, 55-year-old male presented with a myocardial infarction.
He nearly died because of an internal fart. Oh, Mr. Moodley, I always complained about your farting, but from now on you can fart as much as you want.
No, Mrs. Moodley. A myocardial infarction is a fancy way of saying a heart attack.
My poor Krish got one broken heart. Krish, I'm so sorry. It's my fault. What the people gonna say? Mrs. Moodley couldn't be a good enough wife to her husband, and then he died of a broken heart.
We started recess on arrival. He is currently stable. He's an uncontrolled hypertensive and diabetic who defaulted on treatment. He has a 50-pack year history.
Mr. Moodley, I see you have defaulted on your treatment and you're still smoking.
I told him. He didn't want to listen. He thinks he knows everything. And that smoking. Oh, what I must do with this man.
Sister Chetty.
Dr. Chetty.
Sorry, Dr. Chetty. I know how to control my sugar. I'm not stupid. After I have something sweet, I make sure I eat something sour. To counteract the sugar. See, I have a packet of sour jelly beans in my pocket at all times. You want one?
Uncle, that's not how it works. Those sour sweets also have a lot of sugar.
Yeah,
but I read this one article on the Facebook. I spoke to my neighbor, Raj. He said,
Oh goodness, another Dr. Google. I don't know why I bothered to study for 6 years if my patients think the internet makes them doctors.
Daniel, is it? What year are you in?
I'm in final year, Dr. Chetty.
Good. Can you counsel to Mr. Midley on lifestyle modification after the ward round? Let's carry on.
Good morning, Mr. Mudley. I'm Daniel, a student doctor. Dr. Chetty has asked me to come and have a chat with you about your condition.
How are you doing? What the doctor had to say? I came early, but they said visiting hours only started at 7. I told them I'm not a visitor. I'm Mrs. Mudley, Mr. Mudley's wife. So many people coming to see you. They're waiting outside now. The sister said only 2 visitors per patient. What rubbish. Why must I tell all of them waiting? You know, even Rajan and his whole family came. Our sister as well. You know how she likes to show face. Oh, and that Sheila, the way she is performing outside, like someone died. Anyway, I brought you a big pot of biryani and some spicy wings from your favorite takeaway. I know how you like your wings.
Miss Mudley, Mr. Mudley can't eat this. He just had a heart attack.
Yeah, that's why I brought it. It will make his heart very happy, and then you won't have a broken heart anymore.
Miss Mudley, it doesn't work like that. The South African Indian population has a very high incident rate of myocardial infarctions. I mean, heart attacks.
You know, if for true, everyone I know got heart.
Okay, so let's talk about the heart. The heart is a big muscle. To keep anything alive, it needs blood, or else it will die.
Hey, yeah. You know, like how Suresh Kaka's toe fell off that one day?
Not exactly, but yes. A body part will be damaged or die without blood. The same is with the heart. It needs its own blood and its own blood vessels to feed it. If the heart doesn't get enough blood, it will get damaged. This is what we call a heart attack.
Oh, I see, doctor. The heart muscle must get enough blood to keep the heart alive.
I'm not a doctor yet. Just call me Daniel.
What a nice young man. You married? Got one nice girl for you.
I'm concentrating on my studies for now. Thank you, Miss Mudley. But yes, Mr. Mudley, now that we know that the heart needs blood, we need good, healthy blood vessels for the blood to flow through.
Okay, Daniel. I had one heart attack. Everything is already damaged. What must do?
We prevent further injury. We need to look after them to keep them healthy. When you have diabetes, the sugar in the blood damages those blood vessels. That's why we need to control what you eat and to make sure that your sugar levels are normal.
Tawa, what I told you about the sweet things. No, but you don't want to listen. Yeah, finish for you now. And such a big man, but can't handle it when I give him his insulin injections. Must cry and scream and perform.
I know you brought the food with good intentions, Miss Mudley, but food like this is very greasy. When we eat badly, fatty material can get stuck in the blood vessels. They block them, so blood can't get to where it needs to be.
Yeah, like when that fat Sheila comes and stands in the corridor and I can't pass. You know, I can't stand that woman.
Is that the cholesterol they talk about?
Yes, Mr. Mudley. That's why you must always take your simvastatin. Do you do that every day?
This fella, if I don't remind him, nothing will get done. He says he can't take tablets.
My throat is small. Can't swallow.
Can't put those small tablets in, but he can open his mouth wide for other things. Yeah, listen to the doctor. Just like how you mustn't put bad food in your body, or else you'll get stuck and damage those blood vessels. Same way, don't invite that Sheila to come stay by my house when you're sick. And don't talk about the damage she can do with those sweet, sweet words of hers.
Stress is very important to avoid. It causes those blood vessels to go into spasm and close up. The same thing happens with smoking. It's one of the worst things you can do when you have heart disease. When we stress, those blood vessels also do the same.
Ah, but Daniel, those cigarettes decrease my stress. I need them.
Yeah. Tell him, doctor. Tell him nicely. Oh, yeah, the stress he gives me when he smokes. He kills me! Not once, but twice. This man wants me to die. I must die then. Then he'll see who will come and wash his dirty briefs.
What rubbish is this? Daniel, get rid of this food. Mr. Mudley, you just had a heart attack. Mrs. Mudley, do you want to kill the rest of your husband's heart with this crap? You are the reason your husband is in this position. And you, what are you chit-chatting to patients for? This isn't a coffee shop. Go back to your ward work.
Yes, Dr. Miller. Sorry.
Doctor, I don't like needles.
No one likes needles, okay, Neil? Just hold still. You have very difficult veins, and I just have to concentrate. I wish they would fix the lights in this room. I have 20 more patients to see in this HIV clinic, and it's already 1 o'clock. Please hold still.
No, doctor, please stop.
I can't seem to.
No. I'll just come back another day. That's what I'll do. I'll just come back another day. No.
I just need to get 2 tubes of blood. Neil, what is up with big strong men like you being scared of needles? Neil, please, if you keep moving. Ah, crap. The needle. Ouch, ow.
Really? What happened? Oh my gosh, did you?
Yes, a needle stick injury. The needle went in deep. I...
Okay, don't worry. I know what to do. Come, let's wash it off quickly. I'll call Dr. Singh.
I'm so stupid.
Lily, right? Good. Wash it well. Have you had a needle stick injury before?
No, Dr. Singh, the patient is newly diagnosed HIV. I tried so hard not to, but he kept moving.
It's okay. Just relax and let us follow procedure. Let me take your baseline bloods and then we can start on your preventative meds.
You don't have to come with me to the staff clinic to get my treatment. I know you have a lot of patients still to see.
If we don't take care of each other, who will? I know how scary it can be. All medical students have been there. I was there last year. Anyway, I don't mind staying at work for a couple hours extra for patients. I do it most days.
Kiara, I know lots of our friends who have had needle stick injuries. I just thought that if I was extra careful, I know how to take blood. I was so stupid. If only. And there were no gloves in stock. What am I gonna tell my mother?
When you've been up all night, you're bound to make a mistake sooner or later. We are human after all, and humans make mistakes. I know that people think we can't, but at the end of the day, things happen. Things go wrong. It's okay to be gentle with yourself. It's gonna be okay, I promise. Look at me, Lily. It's gonna be okay.
What if I get it? What if I get HIV?
We will cross that bridge when we get to it. HIV is not a death sentence anymore. You know this. You've been working in this clinic for a while now. You know that HIV patients can live the exact same lives as a non-infected patient. You've seen it. They can get married, have kids, breastfeed. You know how far our treatment has come. Lily, no matter what happens, it's going to be okay. And I will always be here for you.
You're right. It's just so different when it happens to you. I mean, HIV seems like it only happens to others. It's just so real now.
Wow, now you can actually understand the fear that our patients have when we diagnose them. The best doctors are the ones who can relate to their patients. Bad things happen, but we should always use them to be better doctors. We have been friends since grade 4. You are like a sister to me. You were there when I went through this. I will be here for you too.
Okay, but...
No buts. I am here for you.
Every day, medical staff choose to risk their own health so that they can help their patients. HIV might not be a death sentence anymore, but it is still a life-changing experience. Who do these doctors turn to when things go wrong? We watch the students deal with stressful medical situations as well as stressed-out seniors. In an environment that is understaffed with a lack of resources, saving lives and keeping your sanity seems almost impossible. But there are good times, such as saving the life of Mr. Mudley and saving him from his own wife.
Next time on Umgeni Med.
How will Lily cope with her needle stick injury? Who is this Dr. Singh in any case? Will Dr. Miller still be in a bad mood? And will Mrs. Mudley finally stop nagging?